In the 19th and 20th centuries, alcohol continued to be widely used for medical purposes, especially for pain relief and anticonvulsant therapy. However, in recent decades, alcoholic solutions have become less used in medicine due to the health risks associated with their consumption. Currently, pure alcohol is used in medicine mainly for the treatment of skin before injections, for the disinfection of instruments and surfaces in medical institutions, and for the production of some healthcare products. But many patients, or just shoppers at the pharmacy, abuse the availability of this product and use it as an aperitif. However, it should be noted that the use of pure alcohol as a drink is dangerous and can lead to various diseases and organ and body systems disorders. And over time, people learn to dilute spirit with other liquids, including water, for safer use. Thus, alcohol has become an integral part of the meal in many countries. Wine and beer do not need to be diluted at all. They have an acceptable alcohol content for the body. However, large quantities of alcohol are harmful in any form. Alcohol is a psychoactive substance that has a rather serious effect on the human body. It is rapidly absorbed into the bloodstream through the stomach and intestines, then distributed throughout the body, including the brain. The effect of alcohol on the human body can differ depending on many factors, such as the amount of alcohol consumed, the weight and sex of the person, and the presence of other diseases. Alcohol affects each individual system of the human body in its own way. Alcohol affects the brain, causing a decrease in the inhibition of the nervous system, which leads to a decrease in sensitivity, loss of coordination of movements, and a decrease in response to external stimuli. It can raise blood pressure, increase heart rate, and increase the risk of cardiovascular disease. Alcohol causes serious damage to the liver, causing it to become inflamed and dysfunctional. Most often, this leads to liver cirrhosis. Alcohol can also irritate the stomach and intestines, leading to nausea, vomiting, diarrhea, and other digestive disorders. Frequent and heavy drinking can reduce immunity and make the body more vulnerable to infections and other diseases. Problems with potency and menstrual irregularities in women can also be attributed to the consequences of ethyl alcohol abuse. In general, prolonged and frequent use of alcohol can lead to serious diseases and damage to the organs and systems of the body, so it is necessary to limit alcohol consumption and monitor your health. There is a difference between female and male alcoholism. Although the mechanisms for the development of alcoholism in men and women are generally similar, there are a number of features that can affect the development of the disease. Women generally have less weight and less body volume than men, and have a high concentration of adipose tissue. This means that women generally have a higher blood alcohol concentration after drinking the same dose than men. In most cultures, drinking is considered more socially acceptable for men than for women, which can affect how often and how much alcohol is consumed. Also, women often have problems with self-esteem, anxiety, and depression, which can increase the risk of developing alcoholism. Women also have an increased risk of various diseases, such as breast cancer and liver disease, associated with alcohol consumption. In general, women may have a higher risk of developing alcoholism than men if they drink the same amount of alcohol or more. Therefore, it is important to consider these differences in the study and treatment of alcohol dependence. Alcoholism treatment depends on many factors, including the degree of addiction, the presence of concomitant diseases and psychological problems, as well as the patient's social environment. Pharmaceutical treatment includes medications that can help reduce the urge to drink and withdrawal symptoms. These medicines may be used in combination with other treatments. The most common so far has been disulfiram. Disulfiram was created in the 1920s by German scientists Emil Fischer and Joseph Berlin. They were looking for a new treatment for gonorrhea and decided to test the property of tetramethyl tetraethylene disulfide to prevent its occurrence. During the study, the scientists noticed the test animals given disulfide developed severe unpleasant symptoms when they consumed alcohol. As a result of these observations, scientists have suggested that disulfide can be used as a medication for alcoholism treatment. In 1948, an advertisement for disulfiram as a cure for alcoholism was launched in the U.S., and since then, disulfiram has been used to treat alcohol dependence. Disulfiram acts as an inhibitor of an enzyme that normally breaks down acetaldehyde, a toxic product of alcohol metabolism produced during alcohol metabolism in the liver. When disulfiram is taken with alcohol, it interferes with the work of the enzyme, resulting in acetaldehyde accumulation in the blood. This causes a number of unpleasant symptoms such as nausea, dizziness, palpitations, and others. These symptoms create an aversion to alcohol and help prevent recurrent alcohol use. Although disulfiram helps people overcome alcohol addiction, its use can cause side effects such as allergic reactions, headaches, depression, and other health problems. Besides, disulfiram is not a universal drug for the treatment of alcohol addiction, and its use must be controlled and accompanied by medical supervision. Psychotherapy is also used to treat alcohol addiction. Psychotherapy can help patients sort out their problems and learn how to manage stress without the use of alcohol. Various methods of psychotherapy may be used, including cognitive behavioral therapy and psychoanalysis. Investigating psychosomatics in people with alcoholism, doctors notice some kind of mental deviation after an overdose of alcohol. The French physician Jean-Martin Charcot in the 1850s made the first systematic and scientific studies of this very disorder, delirium tremens. Charcot studied the clinical manifestations of this condition and determined that delirium tremens is an acute mental disorder caused by prolonged use of large doses of alcohol and characterized by hallucinations, paranoia, anxiety, and disorientation in space and time. Charcot also noticed that patients with delirium tremens had an increased risk of mortality. Today, delirium tremens is a well-known and well-researched condition, and there are many treatments for this condition. Many patients require long-term remedial treatment in a rehabilitation center where they can receive medical care, psychotherapy, and support from other people who are addicted to alcohol. Family and friends can help a patient cope with alcohol addiction by providing them with moral support and assistance in daily life. Some people will find help in self-care, including participation in support groups such as Alcoholics Anonymous or Willpower Self-Help, WSH. It is important to understand that the treatment of alcohol addiction can be complex and requires effort both on the part of the patient and of his environment and medical professionals. However, with the right treatment and support, many people have been able to overcome alcohol addiction and start a new life. There are no exact predictions about the future of alcoholism, but several trends can be identified. First, there is an increased interest in the study of the genetic and neurochemical aspects of alcohol addiction, which may lead to the development of more accurate and effective treatments. Second, as the number of people suffering from mental disorders increases, new treatments may emerge aiming to treat alcohol addiction and mental illness together. It is also possible that with the development of technology, new methods of diagnosing and treating alcoholism, more accurate and effective, will appear. Despite all this, alcoholism is likely to remain one of the most widespread addictions in the world and will continue to cause serious social problems until the problem is fundamentally addressed.